Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video, what I want to talk about is the question that I get very often in the clinic is how long do I have to do my physical therapy exercises for? And the answer to that question, the simple answer is for the rest of your life. Every day, do your exercises for the rest of your life. Now, to leave it at that would be a disservice to my patients and to you as well. So if you did that same physical therapy exercises, your clamshells, your heel slides, your leg kicks, if you did those same 5 or 6 exercises for the rest of your life, you would never do it. You would be bored. You would get so bored with redundancy that you would stop doing those exercises probably within a week or two. And that's normal. That's all right. You don't have to do your physical therapy exercises for the rest of your life. You should do them for maybe a couple weeks, a couple months after you're discharged from therapy, especially if you're someone who you might be trying to get a little bit extra range of motion in your knee. You might be trying to build up just that extra little bit of strength to be able to do certain activities and things that you enjoy. But at that point, you're probably, you don't have to do those same physical therapy exercises every single day all the time. What I do encourage, though, and what I strongly recommend is you should do some sort of exercise every day if you can, or close to every day. And I always say the best exercise is the exercise that you do. So if that is hiking, if that's walking, swimming, gardening, square dancing, playing ping pong, weight training, you name it. If it's a physical activity that gets you moving, gets your leg and your knee moving a little bit, then that's a great exercise that you should be doing. I always tell people we have kind of two main goals. One, we want to maintain your health and your wellness and your ability to do all the activities that you love and enjoy for the rest of your life. And number two, we want to keep the longevity of that knee replacement, of that prosthetic. So we want to have that knee prosthetic be in there and be healthy and working well for you for 20 years, 25 plus years, the rest of your life. And the best ways to do that are good, healthy habits, maintaining a healthy weight, avoiding anything that is super high impact. So things like, maybe cutting and jumping up and down in plyometric type movements might be not the best thing to do, or probably aren't the best thing to do for the long-term longevity of your replacement. But staying physically active and getting moving is absolutely great. So things like playing tennis, skiing, golfing, walking, hiking, even a little bit of jogging, but that's for another video. Whatever activity that brings you joy and brings you happiness, then do that activity. And if you can do that consistently and do that every day or close to every day, then that's going to help your health. It's going to help the longevity of your knee replacement. It's going to help your mental and psychological well-being. It's going to have just tremendous overall benefits for you. I always like to tell people, think about either before you started to have knee pain, way back before your knee replacement surgery, or think about if you never had, if you didn't have any knee pain or any pain at all, what activities would you be doing? What would you be doing? And my recommendation is start doing that. Start trying that exercise. Start trying that activity. And, you can start slow, start easy, start simple, and build your way up from there. If you're someone who likes to jog, don't go run a marathon tomorrow. Start, jog/walk a mile or two, and then build up from there as your body can tolerate it, as your knee feels comfortable to do so. But the more you can stay physically active and doing those activities that bring you joy and happiness, the more your body is going to be able to tolerate those activities, the more you're going to start to retrain your nervous system and your muscles and your body to not have as much pain and discomfort with those exercises. Your knee replacement and your body are both strong and resilient. They can manage the different activities, as long as you're being smart and logical about it. Normal activities, going for a walk, going for a bike, swim, even weight training and things like that. Your body and your knee can tolerate those things. It's all about building up that tolerance, so over time, slowly, and progressively. All right, so the answer to the question, the long-winded answer is you don't have to do your physical therapy exercises for the rest of your life, but you should be staying physically active and doing activities that are physically active for the rest of your life and on a consistent basis. All right. Thank you very much for watching. Take care.